Adverse reactions to food are something that we are recognising more and more commonly in our pets, and usually we see these in dogs, but absolutely we can see them in the other species too. Now that can be either an allergy where you are getting a full-blown kind of immune response to the food, or it can just be an adverse reaction to what they're eating. Now it tends to present in one of two ways, and that's either with GI signs, so vomiting and diarrhea, or it can be with skin problems, and it tends to be that we get the chronic, long-standing skin problems, which often get secondary infections. And these animals tend to be just generally itchy all year round, or they'll have recurrent infections that they keep getting, and they can affect anywhere on the body, so all over, or sometimes it's just on the belly or in the groin, or it can be anywhere on the face. Now, it can be very difficult to definitively prove that an animal is having an adverse reaction to something that they're eating. There are tests available, but it's not entirely clear currently how reliable those tests are or how much we can apply that to the clinical setting. So usually your vet will probably recommend some kind of exclusion diet. And that's where you try and take out as much of the things that the animal might be reacting to and feed them something very specific. And we have a couple of options for how we might do that. The gold standard would be to do what is called a home-cooked, home-prepared diet. So that's where you take usually one type of protein, so one type of meat maybe, and one type of carbohydrates, so something like potato, but you try and pick something that the animal's not had before, and you home-cook that every day for your pet. Now, the downsides to this diet are that it generally is not going to be a nutritionally balanced diet. Now, in the space of an exclusion trial where you might only feed that diet for 6 to 8 weeks, that's not so much of an issue, but obviously long term, that would be a real problem. And it's also a problem in animals that have got other needs and issues. So for example, if you had a growing young animal or a pregnant animal, it wouldn't be appropriate to put them on a non-balanced diet. Good thing about those diets is not only are we very clear on just the 2 ingredients that are going in, but also there aren't any kind of additives or preservatives which potentially could be causing a problem too. And the other good thing about home-cooked diet is they do not have any mites associated with them. So all of our dry foods are probably got some degree of mite contamination, storage mite, and there can be allergies to those too. So if we're feeding a home-cooked diet, we don't have that problem. The next option might be a hydrolyzed diet. Now this is where the companies that produce the food take the proteins that the animal is responding to and break them down really small so that the body doesn't respond to them anymore. Now in a lot of animals that can be really effective at controlling the signs, but actually in some, if they are allergic to that protein, even when it's broken down really small, there can continue to be a problem. They've also still got the problem with the storage mites as it's a dry food, and actually they can be quite expensive, these foods too, so it may not be the best option for everyone. The third option that people have is to go with a proprietary kind of generic diet that's produced and try and pick one that is designed for animals with sensitive skin, or is, for example, something like grain-free. And these products tend to have fewer ingredients in them, and they tend to avoid some of the ingredients that might be more commonly a problem. So if you can pick one that is something based around a meat, for example, that your animal hasn't eaten before, so you can get pork ones or deer ones, rabbit ones, for example. If they've not eaten that before, then that might be an appropriate way to go. Obviously, you still have your problem with your storage mites, but it is a much cheaper product than the hydrolyzed product, and it may be that that's the right option for you. And quite commonly after diagnosis, these are the products that a lot of these animals end up on long term. Whichever diet you and your vet decide to pursue, it's worth mentioning a few things. Firstly, this is a very strict exclusion diet. So when your animal is on this product or this home-cooked food, you need to only feed that food and only water, because anything else can change whether the whole thing is going to work or not. So they can't really have any treats, they can't have any dental sticks. Some of the tablets that we routinely use for worming might be flavoured with things like beefinic, stuff like that, so you need to be careful with things like that, and very much just sticking with this food. It will take several weeks, but hopefully you will see an improvement, and then we'll come up with some kind of plan for what to feed that animal long term. Unfortunately, the only way you can definitively diagnose if it was a food problem all along is once the animal is better on their new food, putting them back on the old food and seeing if all those problems come back again. Understandably, a lot of owners don't want to do that, but unfortunately it's the only way to get a definitive answer.